And I see that in the elderly population, particularly because they're on a lot of medication which dries out their mouth and the salivary flow is depleted. That self-protective nature of the saliva to clean your teeth is gone. And so you have to be very careful with your home care technique, and fluoride can play a role. If I give the patient, I have this fluoride gel called Prevident 5000 that will oftentimes prescribe to patients.
They get it at the CVS or a pharmacy?
Yes, it's a prescribed fluoride because it's a little more stronger.
So you need a prescription for it?
Yeah, you need a prescription for it. There are other that aren't prescribed, like ACT. ACT is a solution, a rinse, a fluoride rinse.
I have that, yes.
But Prevident is a prescription, and it's a gel that you put on at night after you clean your teeth, and you leave it on. And it actually gets absorbed into the tooth, and it makes it stronger, particularly on the root of the tooth that's exposed by recession, which is more cavity prone. It's a great solution to that problem of adult caries. So.
These are supposed to be the golden years, I mean.
I know.
Now, yeah. Dr. Wolfert, you do mouth guards?
I make mouth guards for kids if they want them. A lot of parents are going to the sporting goods store and buying these boil and bites. And
are they good?
Those are good if you can get them to fit well and they're comfortable enough for the kid to wear. My objective is that, you know, I can make a custom night guard. So
and that's for adults, a mouth guard?
Mouth guard is for kids in
what about grinding for
athletic
adults?
Mouth guard? There's two things. There's the athletic mouth guard for the kids that are in sports. And then there's the night guard or mouth guard, which is used for people that have symptoms of TMJ, or they show signs of TMJ, like worn teeth or sensitive teeth or teeth that are breaking. We make them a custom guard so that they can wear it at night or whenever they're grinding their teeth. So most people in this day and age, they're under a lot of stress.
Yes, I grind all the time.
They grind their teeth, and generally they don't even know it that they're grinding it when they're sleeping.
Yes.
They take out their anxieties when they're sleeping at night. So we make these night guards, and we suggest that they use them for nighttime use.
You can't choke. I mean, they're in there tight.
They're in there tight. They're in there tight enough. I use this brand called Comfort Soft, which has a soft inside but a hard outside, so it snaps onto the tooth in a way with a soft material. Then on the top of the mouth guard is acrylic, which is hard, and you can't grind through it. Basically keeps your top teeth away from your bottom teeth, so you're not grinding your teeth together.
And when you grind your teeth, what happens? You lose all the enamel,
Yeah, the enamel can wear off. You can, if they have large fillings, you can crack your teeth so that they break. It can also cause recession of the gums. It causes those little divots in the tooth that form near the gum line. We used to think it was from aggressive brushing, and that might play a role, but we also think that grinding plays a role because the tooth kind of moves a little bit when you grind your tooth, and it causes this little microfractures to occur. So causes some problems.
Now, what about other things? TMJ you mentioned. What does that come from?
TMJ is usually from grinding your teeth together.
So it's wear and tear on those joints?
Exactly. There's a little, there's a lot that goes into your jaw joint. It's somewhat like the knee in that there's a lot of movement to it. It has a little cushion between the top jaw and bottom jaw, a little disc that can wear. The muscles that surround the jaw can go into spasm.
I have that, yes.
And that's what causes the discomfort that you have. So by placing a mouth guard in there, it keeps the teeth separate and doesn't allow that grinding pattern to cause those muscles to spasm. So the idea is to prevent those muscles from spasming.
We have 2 minutes, Russ has told me. What would you like to leave? You'll be my resident dentist. You come all the time. I appreciate it.
I'd love to come all the time.
So what do you want to leave with people today? I mean, anything we haven't touched on?
I think that it's very important that you find a dentist that you trust.
And how often do you go to a dentist? Every 3 months, every 6 months?
Well, you want to start by having a very thorough exam.
X-rays.
Well, that's part of the examination process. Every dentist is different in what they think is beneficial to gain enough knowledge about somebody's mouth to make a good, accurate diagnosis. I happen to take X-rays. I take photographs. I document what currently exists in the mouth in regards to missing teeth and fillings. I do an oral cancer screening exam.
Oh, do you really?
I do a periodontal exam. I look at each tooth individually and see what the gum tissue condition is around the teeth. And I do a dental fitness exam.
Oh, we have to wrap it up, Dr.
Okay.
Wolfert. Well, you will bring, the next time we'll continue.
That sounds perfect.
And I thank you so much. It's fascinating, interesting. It's a wealth of information.
Thank you very
Hopefully
much.
everybody will storm your door and have you as their dentist.
Well, you can find me at 1121 Main Street in South Weymouth. So
Good. I
suite
thank
number
you
2.
so much. Bye-bye.